Hi everyone, welcome to this short tutorial on metformin. Let's learn about the different actions of metformin on various systems in our body. As you know that metformin is an anti-diabetic drug, let's concentrate on what this metformin will going to do on the various system. So let us take the first system, that is the endocrine system. So basically what it does is it controls the sugar level. So primarily it affects the glucose metabolism. So it has got mainly three actions. It decreases the hepatic glucose production, it increases the insulin sensitivity, and it decreases the intestinal glucose absorption. So by decreasing the hepatic glucose production, it will going to reduce the glucose synthesis. So how it will going to reduce the hepatic glucose production? So metformin will going to inhibit the gluconeogenesis process in the liver, thereby it decreases the hepatic glucose production. On the other hand, this metformin will going to increase the insulin sensitivity in case of muscle and fat tissue. Thereby what happens is there will be increased glucose uptake from the blood into the muscle and the fatty tissues. And it in the gastrointestinal tract, it reduces the absorption of glucose from the GIT. Apart from that, these metformin will going to reduce the hepatic glucose production by also acting on the AMP activated protein kinase, which mainly affect the glucagon signaling, as well as it alters the gut microbiome. So basically by acting on the endocrine system, it will going to lower the blood glucose level, especially in case of type 2 diabetes. It cannot be used in type 1 diabetes because type 1 diabetes patient requires insulin. So, and also it controls the hyperglycemia. So you should be understanding this also. It also prevents the progression of pre-diabetic to type 2 diabetes. And also one must remember that it does not typically cause hypoglycemia, that is the low blood sugar, when used alone, unlike the other group of drug. So the drugs like as you know that there is a drug sulfonylurea which will increase the insulin secretion from the pancreas, thereby there is an increased risk of hypoglycemia with respect to sulfonylureas. So such side effects are not present with the metformin. So metformin does not increase the insulin secretion from the pancreas, thereby it is safe from hypoglycemic side effects. So let's move on to the gastrointestinal system. So metformin will going to affect the gut microbiome, thereby it will lead to the experience of the side effects. So the patient will going to experience the common side effect. So here the common side effect of the metformin will be a GI related side effect, like diarrhea will be the most common, nausea, vomiting, abdominal pain, bloating sensation in the stomach, metallic taste, etc. So and loss of appetite. So loss of appetite. So the loss of appetite can be used as a beneficial effect in terms of the obese patient, where it can reduce the body weight as well. So basically it will going to act on the gut, thereby it decreases the absorption of the glucose, or glucose uptake will be inhibited. So that's why to reduce this side effect, what can be done is, so you need to take the metformin along with the meal so that you can reduce the side effect. Apart from that, you can also use the extended release formulation for better tolerance. Next, moving on to the what is the effect of metformin on the renal system. So as you know that metformin is primarily eliminated by the kidney. So kidney has to function very well in a patient who has been prescribed with the metformin. So for instance, if the kidney is not functioning, if there is impairment of the kidney you need to be very careful before administering the metformin. Why? So whenever there is a impaired kidney, the metformin will not be eliminated through the kidney, and metformin levels will build up, and it can lead to increased risk of lactic acidosis. So lactic acidosis is a very rare side effect, but it is most serious, but you need to be very careful in case of renal impairment patient. So when do we say that metformin is contraindicated in case of renal impairment? So if there is a EGFR is below 30 ml per minute, so metformin is contraindicated. So if the patient is having mild to moderate kidney disease, you can adjust the dose of the metformin, and regularly you need to check the kidney function. So next, moving on to the hepatic system. So basically it affects the hepatic system, thereby it reduces the glucose production. So please remember, liver diseases, especially the liver diseases, can increase the risk of the lactic acidosis, as liver is involved in clearing the lactate. So liver is involved in both metformin metabolism as well as the clearing the lactate. So therefore, metformin should generally be avoided in case of hepatic disease as well as in case of the renal impairment. So what are the potential benefit with respect to the liver system? So especially they say that it is very useful in managing the non-alcoholic fatty liver disease, where it will going to reduce the oxidative stress as well as the inflammatory process, and it will going to increase the insulin sensitivity. So next, moving on to the cardiovascular system. So on the cardiovascular system, the metformin will reduce the risk of cardiovascular events like the heart attack, stroke in people with type 2 diabetes mellitus over the period of time. So basically how it will going to affect the cardiovascular system, how it will going to benefit the cardiovascular system means it lowers the total cholesterol, LDL cholesterol and the triglyceride. And also studies have shown that it will going to lower the blood pressure as well. So what are the contraindications for the metformin? So you should be very careful if there is a precaution should be there, because in case of acute and unstable congestive heart failure, it has to be used cautiously because it can increase the risk of lactic acidosis, as already there is a hypoperfusion and hypoxia. So in case of such conditions, you need to go with the insulin. So next is the hematological system, very important. So use of metformin for a long term can increase the risk of the vitamin B12 deficiency. So that is the long term use of metformin can increase the risk of vitamin B12 deficiency, in turn which will increase the homocysteine levels. As you know that homocysteine levels can increase the effect on the heart. So that means increased homocysteine level can increase the risk of cardiovascular diseases. So you should be very careful. So what will be the symptoms of vitamin B12 deficiency? There will be fatigue, breathlessness, faintness, etc. So in the long term users of the metformin, so you need to use the regularly vitamin B12 levels. So coming to the weight, so weight loss is one thing which can occur with the metformin. As you increase the insulin sensitivity, the glucose will be moving out of the blood into the muscle and glucose will be utilized. So although it causes the weight loss, especially in case of the obese individuals, it is not used as a standalone drug for the obesity. Basically it will going to improve the insulin sensitivity and reduces the appetite. Next, moving on to the reproductive system. So on the reproductive system, it is more helpful in case of polycystic ovarian syndrome, that is PCOS. So it is used as a off-label to treat the PCOS condition, where the condition is mainly due to the insulin resistance. So once you give a metformin, the insulin sensitivity will increase and it will further improve the fertility in case of women and promotes the ovulation. And also it has been said that it will improve the male fertility as well, especially in case of obese patient. So next, coming to the other benefit which can be seen with respect to the metformin. So the observation studies have shown that it lowers the risk of certain cancers like the colon cancer, pancreatic, liver, and the breast cancer, and also basically by inhibiting the cell growth and prevents the tumor development. And also the studies have shown that it increases the longevity and it can act as an anti-aging property, basically by reducing the inflammation and improving the metabolic health. And also it will be very helpful in case of dementia, as it lowers the risk of dementia, and dementia has been proposed, the causative factor of dementia can be due to the insulin resistance in the brain. So important consideration what you should keep is, although it is a rare side effect, the lactic acidosis can occur with the individuals who are taking metformin, and it can be severe as well. So what are the symptoms you need to identify to make sure that the patient is having lactic acidosis? So please remember, the patient may have extreme tiredness, weakness, nausea, vomiting, abdominal pain, rapid breathing, dizziness, as well as muscle pain. And all these symptoms, if the patient experience, they need to take a immediate medical attention. So interaction, there is an interaction with respect to the alcohol. So since alcohol is metabolized by the liver, so alcohol consumption should be limited, as it can potentiate the effects of it can decrease the effect of metformin, and it can cause lactic acidosis as well. So and also please remember, the individual variations will be there with respect to the side effect as well as the beneficial effect. In summary, the metformin is used as a primary drug for the management of type 2 diabetes, and it will decrease the blood glucose level, and it also has got beneficial effect on the cardiovascular system. It has got apart from the diabetic use, non-diabetic use will be the polycystic ovarian syndrome in certain cancers. And also you should be very careful when you are giving the drug with the kidney and liver function derangement, so because it can increase the risk of lactic acidosis. In total, if you want to revise,